Hi guys, it's Miss Palmer again, and I'm going to show you oral care. Remember, that goes with personal hygiene. So it's usually the first thing we do when we're going to go ahead and do personal care for the client. So I'm going to show you a couple different methods here. The first one is your toothpaste and your toothbrush. So we're going to we're going to offer the client the ability to brush their teeth twice a day, in the morning and at night. This is called an emesis basin. This allows them to go ahead and then take a sip of water and rinse their mouth out. Hopefully the client can do this for themselves. It's much easier if you just kind of set everything up on the table and you put it in front of them and they're able to complete this task themselves. However, if you need to, you can go ahead and use this toothbrush to go ahead and brush their teeth as well. Dentures, again, remembering with each one of these you would need to wear gloves. So dentures most often will be in a cup if you're just getting there in the morning and they've soaked overnight, or they would be in the client's mouth. So if they're already in the cup, you want to go ahead and take your toothbrush, your sink, you're going to put a towel down or some paper towels down in the sink so that if you accidentally drop them, you don't chip them. They cost around $1,200 a set, so you don't want to break these if you can help it. And then you're going to go ahead and brush them like you would normal teeth. Rinse them in lukewarm water, and then you would go ahead and hopefully, again, the client can put them in their mouth themselves. If not, you can go ahead and pop it in their mouth. Same thing with the bottom. Kind of a trick, if the resident or patient's having a hard time getting them out of their mouth, have them make a little air in their mouth, and it will actually pop the seal of their dentures. If a patient is, and this is usually utilized in most of the acute care settings, if they are unconscious, or sometimes I'll use this if they're NPO and I want to do aggressive mouth care every 2 hours, I'll use this suction toothbrush. So inside the suction toothbrush kit is a suction toothbrush. Got this funny sort of piece down on the bottom here, and some mouthwash. But before you open the kit, if you go ahead and you take your 2 fingers and pop this open, and hopefully I won't get myself wet. So before the kit is open, you pop that mouthwash open. It then will become easier for you to use when you just open the package halfway. So you're going to use that mouthwash. Suction toothbrushes are the hardest to do in terms of oral care. You have to make sure the unconscious patient is in a side laying position, whether it's the right or the left. You may have to put something underneath to catch any secretions that may come out of their mouth. And you want to make sure you're utilizing the suction at all times so they don't aspirate. So I'm going to show you how to do that. I'm going to leave this client in this position, but just please keep in mind that they need to be rolled onto their side. Putting on gloves. And really what I want to show you is how to hook it up to the suction on the wall. So if you look at this container, I'm going to bring this right out. You can see it's labeled. And you'll be able to get a little bit better view of it when you get into the lab. But there's actually a hose that says patient. That's going to be the hose right here that you're going to be hooking up the toothbrush to. There's one that says vacuum. and that should be hooked up to the wall. So I'm going to get some mouthwash on there, and I'm going ahead and attach it to the suction tubing, and it just pushes right in. Make sure it's in there tight though, you don't want to lose that toothbrush in somebody's mouth. Then there is, on this green part, a little hole here. Just like if you were to go to the dentist, if you go ahead and put your thumb on that hole, you're going to create suction. I'll show you that in a minute. So that's going to be, remember, thumb on means you're suctioning. Thumb off means you're not. Thumb on means you're suctioning. And this is going to play another important piece when we get down to suctioning a patient. Same concept. To turn it on, I'm going to go ahead and pick the regular. The other one means intermittent, and I don't want it to be going on and off, on and off. I want it to go on all the time, so I'm going to pick regular. And I want it over here in the lowest suction level. I don't want it to be in the yellow or the red. That would be too much for my patient's mucous membrane. So again, while they're on their side, thumb on it. And I know you probably can't hear that, but it makes a noise when your thumb's on it. That's how you know you're suctioning. You're going to go ahead and you're going to take and put that in the mouth, making sure you use this little padded piece for the tongue, around the gum. Remember, suctioning the whole time to get all that liquid out. We don't want the client to ask for it. These are one-time use, so you don't want to use them again, so you would go ahead and throw that away. These can be used again if they are extremely dirty. You could go ahead and change them, but they can be used multi-times. So you put that back up here, turn the suction off, and then take off your gloves, wash your hands. The last piece I just want to show you real quick are these toothbrush, or pink swabs, we'll sometimes call them. A lot of patients who are NPO might have these in their room with a little bit of water in a cup, and they've got this in the cup. So they'll use these to moisten their mucous membranes. Remember, we don't want any breaks in the mucous membranes because microorganisms can get in. So if your client's NPO, or if they need aggressive mouth care, like they have an NG tube, all those things you learned in fundamentals, you're going to go ahead and use these. They're great for that. These are, again, should be used once every time. The only other thing you got to be careful of is that the client doesn't put it in the water and then suck on these if they're NPO. So please make sure you watch that as well. You may have to do some education with the patient. And that's oral care.